Hi, how are you, doctors? Today I'm gonna show you some little tips on how to use our EMR system here in Sinai Medical Center, which is eClinicalWorks. So let me show you how it looks. Okay. So now we'll show you some tips on how to work on our EMR system, which is the eClinicalWorks in Sinai Medical Center. First of all, you have to put the username, which is Amin, and the password, which is Mustafa32. Then log in. Then you go to this search button, and you can search by patient date of birth, you can search by name, you can search by whatever, but usually we search it by date of birth. So for example, we can search for a test patient. Okay, and then you go to the progress note. Let me do again. So test, and you go to the progress note. Once you go to the progress note, usually the front desk guys open a new appointment for the patient. But if you want to open a new appointment for a patient, you go to the hub here, and then you click new appointment, and then you put the visit type. For new patient, we put initial visit. For follow-up patient, we put follow-up. And then the visit status. Once the patient comes here in the office, we can put checkout, and then you click OK, then yes, then progress note, then yes. Now we have a new visit, but a new empty visit. Now once you can now talk to the patient and see what brought the patient over here today. If the patient has like upper respiratory infection, for example, or sore throat or whatever, we have a template for that. We have a couple of templates over here, right in the right corner of the screen here. You see templates. We have a couple of templates. A template for sinusitis, a template for flu, URI, UTI, GERD, low back pain, whatever. So we can use these templates if the patient has any complaint compatible with these templates. But if the patient don't have any of these templates, you can just check follow-up and review of systems over here, and this template will bring here the preventive medicine and the visit codes and some basic stuff in the note, which is the review of system stuff, and the examination section, which is all normal, but just bring it as a template. And then you can put the patient's complaint. You can write down whatever the patient has, like pain in the right hand for 2 days, whatever the patient has, etc. And you can put ears pain, whatever the patient has, you can type it here in the complaint section. And then you go to the current medication section, and you can adjust the patient medications here. If you find any acute medication or a medication for acute problem, you have to take it out. You have to discontinue this medication, because this section should have the active medications for the patient. So for example, this patient has Ceftin antibiotic, we have to discontinue Ceftin, discontinue Claritin, discontinue Flonase. Prozac is a chronic medication, we have to leave it, and we have to ask the patient, we have to confirm with the patient if he's taking this medicine or not. If he's taking Naproxen, this is an acute medication, we discontinue Augmentin. Vascepa is a chronic medication, we have to confirm with the patient that he's taking this medication. Zempab, same thing. Voltaren gel, we have to take it out. Tamiflu, we have to take it out, and then we have to verify this section after we finish. Then we'll go to the next section, which is medical history. We have to verify this section with the patient too. If he's a new patient, we have to ask if the patient has any medical history. If he's a established patient, just verify the medical history. Then we go to the allergy section. If a new patient, will ask him about the allergy, if he has allergy to any medicine. If he doesn't have any allergy, we just check allergy verified. Then we go to the surgical history section. We ask the patient if he had any surgeries. For example, this patient had knee surgery. We put knee surgery. We have to specify which knee, in what knee. So if he says right knee surgery, you put knee surgery. If you know the name of the surgery, like ACL repair or whatever, we just put the surgery name. If we don't know, just put that the patient had a right knee surgery, and we put the date of the surgery, let's say in January 2018. And then we go to the hospitalization section. If the patient was hospitalized to whatever hospital, we put over here that the patient was admitted to Maimonides Hospital on let's say, for example, the patient was hospitalized on August 1st 2018 and discharged from the hospital on August 8 2018 due to chest pain. So whatever, if the patient was admitted to the hospital, we have to document this in this section. This is very important. And then we go to the family history section. Usually we care about the father and the mother family history, but sometimes the family history of the sons and of the sisters and of the brothers is important too. In some problems we have to ask about these, but mainly we ask about the father and mother problems. We ask about if the father and the mother has any chronic medical problems, diabetes, hypertension, cancers. So if the father is alive, we put alive. If the father is dead, we put deceased. And if you want to check that the father has diabetes, for example, you just check of diabetes. If he has heart disease, check heart disease. If the mother had cancer, we check the cancer over here. If you want to specify the cancer type, you can just type breast cancer here, or you can click the note over here. You see? So the mother has cancer here. If you can't put it over here, you see, we cannot edit this section. Just go to the note over here and put whatever you want. Breast cancer, and you can, if you want to put the date, the age, you can put age 40, for example. Okay. If the father has cancer colon, which is very important in it runs in family sometimes, so you click the note over here and you put cancer colon age 42, for example, and then okay. So, and then you put verified. If you come to this note again, you will find that this patient father has cancer colon age 42. If you just click over the note over here, you will find cancer colon age 42 of the father. If you go to the mother, you'll find breast cancer age 40. This is very important. Then you go to social history. Social history, we check on the smoking history. First thing, we ask the patient if he smokes or not. If the patient smokes, you put current smoker, and then you ask him how frequent he smokes. If he smokes 10 cigarettes, 20 cigarettes, whatever he smokes, you just put that. Let's say that he smokes 1 pack, which is 20 cigarettes, and then you click save. Okay, and then you ask about if the patient is doing alcohol, or if he takes any drugs or something. There is a little questionnaire here about alcohol screening. You ask the patient if he drinks alcohol. If he drinks alcohol, you put yes. If he doesn't drink, put no. If he drinks, you put yes, and then we ask him how frequent. If he just drink alcohol socially, you put just monthly or less. You just put whatever the patient does, and then save. And then you have to verify this section. Once you verify the stuff over here, it stick to the patient's chart forever. Then we jump to the vital signs section. You put the patient's vitals, the nurses here takes the vitals, you put the heart rate, you put the blood pressure, you put the patient's weight, you put the height, which is 70, and then once you put the weight and height, the BMI comes right away, and after you finish, you click vitals taking. You click vitals taking, and then you close the section. Then you go to the assessment section. If this patient, for example, we put in the complaint that the patient has pain in the right hand for 2 days, so the assessment, the primary assessment has to be hands pain. Okay, we have most of the diagnoses or the assessments in a favorite list. So make sure before you check any assessment to check this little star to make it yellow like that. So when you put pain, you will find the diagnosis right away. And instead, if you don't put this star and you put pain hand, you will find many diagnoses and you get lost. So make sure before you check the assessment, you have this star. So pain in the hand, this is number one diagnosis. If the patient also has like GERD, for example, heartburn, okay, then the second diagnosis has to be GERD. Okay, so I didn't put the star. You see how many diagnoses we have. If I put the star, I will get GERD right away. Okay, and then you put the diagnosis that you talked to the patient about. If this patient has hypertension, you check hypertension. If this patient has diabetes, you can check on diabetes. Make sure you have 4 assessments over here. The one that the patient came with this visit, and the chronic problems, you have to put the chronic problems in the assessment. The chronic problem that the patient is taking medications for, like hypertension or diabetes or high cholesterol or high triglyceride, and you have to counsel the patient about these problems. Then you go to the treatment section. For this patient, for example, we're gonna prescribe naproxen, which is a painkiller. So you click the naproxen in this bar. Again, let me show you again. The patient has pain in the right hand and you want to prescribe some pain medicine. You check the treatment over here, and then you write naproxen. Make sure you have the star. You remember about the assessment thing? We have the same thing here in the treatment. Put naproxen, you have the star. If you don't have the star, you will get many diagnoses. If you have the star, you will have only naproxen. This is like a template. This is a template prescription. So you just check on the template, okay, and you will have this medicine under pain in the hand. If you want to prescribe any medicine, any other medication, let's say this patient has GERD. We're not supposed to prescribe naproxen for a patient that has GERD. So let's, for example, change it to Tylenol. Okay. If you want to give him a medication for GERD, for example, you want to prescribe omeprazole. So you put omeprazole, but the omeprazole comes under pain of the hand. So we need to put the omeprazole under the GERD section. You check this arrow over here. You see this arrow over here, and you put order details. And here you can reorder the medications to be under its own assessment. So the omeprazole here goes to GERD, and the Tylenol goes to the pain on the right hand. And then you check, okay, you see it reorders. So the Tylenol under the hand pain and the omeprazole under the GERD. Okay, let's say for this patient we need to order X-ray on the hand. You see, you go to the pain on the right hand section. You have this little circle, which is add notes, and you can add whatever you want. You can add X-ray of the right hand, and then okay, it will goes under pain on the right hand. Let's say for diabetes you want to refer this patient to the eye doctor. You can check the notes, circle, and you put refer to podiatry and refer to ophthalmology. Okay, and you check okay, so you will have these referrals under the diabetes mellitus assessment. Okay, then we go to the ordering of the labs. For a diabetic patient, we order A1C every 3 months. So for these patients, we have order set. We have order set for diabetic patients because this patient has to do blood work every 3 months, not like other normal patient. So to order a lab, we have 3 main labs that we deal with. We have BioReference, we have Quest, we have LabCorp. Most of our patients, we send them to BioReference, so we have many templates here for BioReference. There is one for male patients, there is one for female patients, there is one for hepatitis panel, one for pre-employment patient. If the patient is applying for a job, they need a specific blood work and drug screenings. We have templates for all these patients. We have one for pre-operative evaluations for patients undergoing surgeries. So for example, this patient is a diabetic patient and he's fasting and we need to do a blood work for him. You go to the template diabetes, you check the patient's insurance. If the patient's insurance go to BioReference, you go over here on the OS section and you click OS and you check 2 diagnoses. Usually we check 2 diagnoses. Okay, so we check diabetes, we check hypertension, and then okay. And then over here you will find the set of labs that already customized to these patients. You check on it. Okay, make sure to check if the patient had microalbumin or not, because diabetic patient we order microalbumin once a year. If the patient had microalbumin recently, less than a year, make sure to remove it. If the patient didn't do it within a year, click on it. And then once you click all these, you check order sets. You check order selected. You will get this little questionnaire for the diabetic patient about the ethnicity, about whatever the patient has, whatever the patient is. If the patient is white, you put white. If the patient is African American, you put whatever. If you're unknown, just make sure to fill out this questionnaire, because if you don't fill it out, this lab will not be ordered. And then okay. Once you check okay, you see all these labs came to this section under hypertension and diabetes. You remember we checked 2 diagnoses. These labs comes under these diagnoses. After you finish this part, we have to print 2 things. We have to print the report, the lab requisition, which goes to the lab, and we have to print 2 little labels, which goes on the tube that goes to the lab too. So to print the requisition, you check here print labs, and then on the mode over here you have to change it to e-transmit. Make sure to change it to e-transmit. And then sometimes if we order on Quest, for example, okay, let me clear this again. This is for BioReference. This is for BioReference. You change the mode to e-transmit and then send. Once you click send, you have to print this paper, which is the requisition, which goes to the lab. You see, it has all the labs that we requested. It has diagnoses that we checked. It has a patient name, patient date of birth, patient's insurance, everything, and you print it over here and then print. Once you print it, you will print this paper. And then we need to print the little label that goes on the tube on the blood tube, you go to the hub, and then you print labels. Okay, and that depends on how many tubes you're going to send. For this patient, we need 2 labels. We need 3 labels. We need 2 for the tubes, and you remember we added the microalbumin, which is a urine test. So we need 1 more label for the urine test. So you check number of copies, you change it to number 3. For example, if this patient is going to do a surgery and we need to add the INR. The INR is a different tube. We can change these to number 4. So you adjust the number until to how many copies you want. If you want 2 copies, 1 copy, 4 copies, you just do it and then click print. Okay, so this is for bioreference laboratory. Let's say, for example, we need to print a lab that goes to Quest. A lab that goes to Quest. Okay. Okay, so let's say this patient has HEB insurance and his blood work will go to has to go to Quest. So this is a male patient. We go to Quest, male patient or male panel, and we'll click on the OS and we'll check 2 diagnoses and then OK, and then you check all these all the set labs, and after you check on them, order selected, and then you will find these labs under these 2 diagnoses. But remember, this patient is a diabetic patient, and we need to order hemoglobin A1C, we need to order the microalbumin, but these ones we don't have templates for these things. So you go to the treatment and you go to labs. You see the section labs, you go to labs, and you go to lab company and you change it to Quest, and you can search whatever labs you want to add, hemoglobin A1C, but make sure to change this lab company to Quest, because each lab has its own labs and has its own set of orders. So check hemoglobin A1C, and then we need to add the microalbumin, the random microalbumin. You check on the microalbumin. Okay, so you get these 2 on the list over here, and then you close this screen. You see, you have it over here. You have hemoglobin A1C and you have microalbumin, and then you close this screen. Now we order the labs that we want to order. We need to print the 2 things, the requisitions that goes to the lab and the 3 labels that goes on the tubes and the urine test cup. So you print labs, and here we order this lab to Quest. You see over here, configured for Quest Diagnostics but sent to bioreference. You see, this doesn't work. This will not go through. You have to change this lab over here from bioreference to Quest and check apply to selected. Okay, so this was that one was bioreference. We changed it to Quest and then apply to select. Okay, and the mode is changed automatically to e-transmit. E-transmit is very important because this lab will be sent electronically to the lab before they even receive the lab requisition. This is very important for the lab. Okay, and then we check send, and we print, and we'll print the file and it will be printed. You see, the requisition for Quest is totally different than the one for bioreference, and the one for LabCorp is different than this one too. Okay, and then you check done, and after you finish this step, you go to print the little labels that goes on the tubes. Print labels, and then you change the number to 3 because we have 2 tubes and 1 cup, 1 urine cup. Okay, change this to number 3 and then print. Okay, so after all these, let's say this patient is going, we're gonna send this patient to do like any procedure in our office over here. This patient has let's say a burning sensation in the urine for like 4 days, and we need to do a quick urine dipstick here in the office to check his urine. So in the procedure over here, you send this patient to do urine dipstick, so you type urine dipstick, and once you get the results back, you put the finding. Urine dipstick is positive for blood. Okay, so you put any procedure over here. A patient will send them to do PFT, you put PFT. A patient will send them to do API, you put API. A patient will send him to do DPA, you put DPA. A patient will send him to do EMG, you put EMG. Any procedure that within the patient to do here in the office, you type it over here. Let's say a patient will give him a B12 shot, you put B12 injection. Okay, then if you want to put if you want to change the next appointment, usually the template has 4 weeks follow-up appointment, but you can change it. You can change the follow-up appointment. Let's say we need to see this patient after 2 weeks, not 4 weeks. You go here and you change number 4 to number 2. Okay, and then you close the section. It will be changed to number 2. Okay, so now we finished with the patient. You need to find what pharmacy this patient is going to. To change the patient's pharmacy, you go to information section over here, and then you check pharmacists, and then let me remove these two, and then you check the pharmacy, and then you click add, and you ask the patient about his pharmacy. Let's say a patient wants to go to Nile RX pharmacy, so you check Nile RX pharmacy, and you will find the pharmacy over here. You click the pharmacy and you check OK, and then you check on the pharmacy here on this area to be the primary pharmacy for this patient, because some patients has more than one pharmacy. They get some medication from one pharmacy, they get other medication from different pharmacies. If you want to add another pharmacy, you can add another pharmacy. Let's add a patient wants to go to St. Mary's pharmacy. You put St. Mary pharmacy, you click the St. Mary pharmacy and OK. If you want to change St. Mary's pharmacy to be number 1, you change it to number 1 to be the primary pharmacy, and then you check OK. Okay, some pharmacies we don't find it in our system. Like a patient wants a Rite Aid pharmacy in New Jersey or a Rite Aid pharmacy far away in Manhattan that we don't have. You try to add this pharmacy, Rite Aid, whatever. The patient gave you a pharmacy or gives you the phone number of the pharmacy, and you put the phone number of the pharmacy, and you can't find the pharmacy over here. Let me tell you that you can check for the pharmacy by different means. You can check by name, you can check by zip code, you can check by phone, you can check by address. Usually we check by the phone because the phone is very accurate. So if you put the pharmacy phone and it doesn't show up over here, it means that we don't have this pharmacy on our database. So we have to add this pharmacy to our database. You go to this store over here, and then you see there are 2 lists over here. You go to this list, you go to linking pharmacy. You see linking pharmacy. You click linking pharmacy, and you will get this screen. This screen, it has the local pharmacy database, which is the pharmacies that we have in our system as Ben Sinai, and here the e-prescription pharmacy database, which is a database of all the pharmacies all over US. So a patient is gonna give you the pharmacy phone number. You put the phone, You put the pharmacy phone number. Let's say let's try any date of let's try any phone. Okay, so let's say this pharmacy, Bangla Pharmacy.
اوكي. ابدأ من أول من قبل بتضيف
الفارماسي زي
يا الفارماسي يا تاني.
اوكي.
لا بعديها انت بعد ما ضفت
اوكي
اللينك بتاعك وتعمل سيرش على التليفون. انت بتعمل سيرش بالتليفون مثلا بايفون.
Okay, so for example, we're gonna search for this pharmacy by phone. The patient will ask the patient, give me the pharmacy phone number. If he has a phone number, he will give you the phone number. If he has the address, he will give you the address. If he has the name, he will give you the name. But usually you will prefer the phone. So the patient will give you the phone, you will put the phone, and you have to put the phone in this way, in this format, 718 and then little space and then 689 and then you put the other four numbers. Okay, so let's say this pharmacy is called ABC Pharmacy. You click ABC Pharmacy and then you check import successful. So this pharmacy was imported from the global US pharmacy database to our local pharmacy database, and then you close this screen and you go to info and try to add the pharmacy to the patient's chart. So click add and then click ABC Pharmacy. You will find ABC Pharmacy here and then okay. And if you want to make this pharmacy the patient's primary pharmacy, you click the patient primary pharmacy and then okay. In this area you can as well change the patient's demographic. If a patient moved from his address to another address, sometimes the patient tell you I need to change my address. You can change it from here. This is the address. You can change it, for example 6903 3rd Avenue. This is not Florida, of course. Brooklyn, New York 11209. And then after you bought this address, you can validate this address. You check validate over here. It will give you two different addresses. Check the green one. The green one is the right one. This is the UPS address, which is the right one. And then apply. Okay. You can change the patient's cell phone number from here. If you want to put the patient's cell phone number, work number, if you want to put the patient's email. Sometimes this section is not right. You have to make sure the section is right. If a male patient is a male patient, if a female patient, put a female patient, because some patients are not right here. This part has to be filled out as well. It should be filled out by the front desk, but if you find it blank, we can't fill it out too. You see the race, you have to put the race, you have to put the ethnicity, you have to put the language. These three sections are very important. If you want to edit the marital status, you can change it from here, single, married, or whatever, and then you check OK. Okay, so now we added the pharmacy. Now we want to send the medicine to the patient. Then you go to the treatment section and you check send, the arrow behind send, close to send. You check this arrow and you click ePrescribe RX. You check ePrescribe RX. Okay, so this patient has 3 pharmacies now. This patient has 3 pharmacies and he needs his medication to be sent to Nile RX pharmacy. You see, make sure to put some effort in this step, because sometimes we'll try to send medication to a patient and we send it to the wrong pharmacy. This patient wants his medicine to be sent to Nile RX, so check Nile RX from here. You see this this box. You click Nile RX and then you check apply to select it. So the pharmacy over here will be changed from the other one to the Nile RX pharmacy, and then you send the medication. Let me send this Tylenol prescription to Nile RX pharmacy. I don't think they will mind that. Okay, so send. One prescription transmitted successfully. To make sure that this prescription was sent successfully, you can go and check on the log. You go to hub and you go to logs and you go to e-prescription logs. You will find that a new prescription was sent to Nile RX pharmacy at August 29, 2018 at 7 o'clock p.m. and 8 minutes. This prescription was sent successfully. You see, status success. Make sure the prescription has success status. Okay, and then you close. So now we took the patient's complaint, we verified the history, we verified the family history, the surgical history, the allergy history, we verified everything. This patient complained of pain on the right hand. We need to document this on the examination section. So we'll go to the extremities here. You see the extremities here, the green thing. You click on the green thing, and then you will get this screen. If you want to put tenderness on the right hand, so tenderness on the right side of the hand, we can check whatever signs. You can edit whatever signs you found. You can edit and then click OK. Okay, you will find this section. Change it to tenderness of the right side of the hand. Let's say that this patient, while examination, you found some epigastric tenderness. You will go to the abdomen section. You see the abdomen section. You check or you click on the green icon, and then you can change it. The patient has girding or rigidity. You can remove the no. The patient having some rebound tenderness, you can put rebound tenderness. If a patient has epigastric tenderness, you can edit whatever you want. So you can edit this section by clicking on the green thing, and you can edit whatever you want to. Then after you finish all these things, you check the procedure codes over here and make sure to put number 1 over here. You see, put number 1 over here, number 1 over here, number 1 over here, and then you click done. Okay, let's say a patient, we haven't seen him for a year. We haven't seen a patient for a year, and we need to do a preventive. We need to do a preventive for him. So you go to this yellow sticky over here, and you put PE, which is a preventive visit abbreviation, and then you put today's date. Today's date is August 29, 2018, and then save. You will find this preventive date on the yellow sticky, but we need as well to add the code for this preventive visit here to this note. So this patient is 73 years old. Make sure to check the patient age, and then you check the procedure codes, and then you check add EM, yes, and then you go to the preventive medicine over here, and then you check established patient, because this patient we have seen him before. If you haven't seen this patient before, we check the new patient, but this patient is established patient and his age is 73. So we have different ages over here. This patient will follow this category: preventive care, established patient, age 65 and over, and you check it, and then okay, you will get this code over here. Okay, and after you finish all these things, you can lock the note. And for some reason, if you want to edit, let's say like this patient, we need to send him another prescription. We need to send him refill on the Prozac, and we already locked the note. We can unlock the note by clicking this arrow and then unlock and then yes, and then the note will be unlocked, and we can go to the treatment section and we can go to current RX over here. This is how to refill an existing prescription. Let me tell you again. So you go to treatment and then current RX, and then you go to Prozac. He needs refill on Prozac, so you go to R circle, and we click the R circle and then close. So now the Prozac here, you can do refill, but you see it is refill, not start, because you clicked refill. Then the arrow again and prescribe RX, and this is make sure the prescription is right, but you see the same issue came again. The Prozac is under ABC pharmacy, and we need to send this prescription to NileRx pharmacy. So you go to the patient's pharmacy, you change it to NileRx and click apply to selected. It came back to NileRx pharmacy, and then you can send it. Okay. Let me tell you something else. Let's say a patient is taking like enalapril or Vasotec 10 milligrams, and we need to increase this. The patient's blood pressure is very high, and we need to increase the dose from 10 milligrams to 20 milligrams. So you can check on the patient prescription and then go to the status, and you can check increase. Okay, and change this strength from 10 to 20 milligrams. Okay, and then check OK. So you see over here we might have different status for different medication in the same note or in the same plan. So you see the Prozac is refill, the Tylenol is a start, the enalapril is increased from 10 to 20 milligrams. These things are very important. It's very simple and very important, and when somebody gets back to this note, he will know everything. Don't just put enalapril 20 milligrams. You have to put some notes for any doctor that comes back to this note. Okay, and then close, and then we'll lock the note again. Okay. Okay, let me make a new note for you to give you some more informations. Okay, so we're gonna open a new note for this patient. We're gonna check the hub, check new appointment. Okay, you check the visit type, which is follow-up. Status, the patient arrived here at the office, so you can check out, then okay, yes, progress note, yes. Okay, you will have a new visit with some medications, but everything else is blank. Let's say the patient comes here today for some burning sensation in the urine, some burning sensation on the urine. You can check this note, this template, which is UTI. You check this UTI and you send the patient to do the urine test. And this is the first thing. Then you can edit this complaint section. You can add, let's say for example the patient is complaining from like lower back pain radiating to the left thigh. You just put low back pain. You take the history, like a regular history. Right back pain, low back pain radiating to the right thigh for 3 days, increases with activity. You put whatever the patient's complaint, You can as well put, like, if a patient is complaining of abdominal pain, right upper abdominal pain, you can add many complaints to the same note, and then you close the section, and then you check the medications, make sure there is no acute medication. Tylenol is an acute medication, you discontinue this medication. Let's say the patient, you find a Zimpab prescription in the patient's chart, and the patient doesn't know if he's taking this medicine or no. Sometimes the patient doesn't know. You can check not known, or you can check unknown. Let's say a patient has enalapril 20 milligram and he doesn't take this medicine. He doesn't take it at all, or he's non-compliant with the medicine. You can check not taking. So we have different squares over here. Everyone has a meaning. Taking means that the patient is taking this medicine. Not taking is not taking. This non-compliant with the medicine. Unknown, you don't know, and the patient doesn't know as well. Discontinue, which is the patient discontinued this medicine, which is most probably the acute medication. After you finish this section, you click verified. Okay, and then you have to verify the history. This is very simple and fast and quick step. You just history verified, allergy verified, surgical history verified. You ask the patient if he had any new surgeries. If he didn't have any new surgery, just check verified. Hospitalization verified, family history verified, social history verified. And if you come to a patient like that, he's a smoker, try to counsel this patient about if he wants to stop smoking or not, and you have to provide him with the option to stop smoking. Then the vitals, you should put the vitals over here, whatever the numbers are, you put the numbers. Okay, and then you check vitals taking, and then the assessment part. Here you have UTI, you have lower back pain, you have abdominal pain. You check the assessment, you check the star, don't forget this star, and then low back pain, you will get low back pain. Abdominal pain, you check abdominal pain. We have most of the diagnoses in our favorite list. Okay, and then close. And then let's say the patient did the urine test and he had some infection, and we need to prescribe Cipro. This template has Cipro. Okay, let's say if you want to change Cipro to a different antibiotic, we need to change it to macrodentin or macrobid. You check macrodentin and you check the new prescription. So you remove the other. You can remove a prescription from here. Delete. You can delete this prescription from here, and you add a new one from the same thing. From quick order, we need to prescribe macrodentin. We need to prescribe some naproxen for the lower back pain. So naproxen. Okay. We need to prescribe some dicyclomine for abdominal gases or abdominal distension. You put dicyclomine or bentyl. And after you check these medications, you see these 3 medications are under urinary tract infection. If we need to reorder this list, we go to this arrow here and then check order details, and you can mix and match. Bentyl goes to the abdominal pain, macrodentin goes to UTI, naproxen goes to low back pain, and then okay, and you will see if the medication comes under its assessment. Let's say we need to add X-ray or MRI of the lower back pain. You add note and you put MRI of the lumbar spine. Okay, For the abdominal pain, we need to do some ultrasound. We need to do ultrasound of the abdomen. You click the note, you put abdominal ultrasound. Okay, you see how nice the note. The UTI, macrodentin, lower back pain, naproxen, and MRI of the lumbar spine, abdominal pain, Bintel and abdominal ultrasound. If you need for the lower back pain to add a referral for physical therapy, you can as well add refer to physical therapy. Everything you do to the patient, you have to document it in the note. Everything, because we have phone calls all the day from the imaging places, from other doctor's office. They ask, what do you do for the patient? What do you want for the patient? Do you want to do MRI, or you want to do CAT scan, or you want to do X-ray? What do you exactly want to do? So the doctor that takes this phone call simply goes to the note, and he will see that what exactly we ordered to this patient. For this patient, we ordered MRI of the lumbar spine. That's very simple. He will tell them do MRI of the lumbar spine. If he doesn't find this little note over here, he will get lost. Okay. Then in the procedure, this patient who did urine dipstick, it's already here because it was mentioned in the UTI. If we have done anything else, we mention it, we open the procedure. Let's say, for example, we did ABI to this patient's visit. We put ABI. We have to document everything. Everything has to be documented. Okay. What else? Okay. Let's say we have a couple of assessments over here. We have an asthma assessment. We have to do it yearly for our patients. We have a depression assessment. We have some assessment for obstructive sleep apnea. A patient with some obstructive sleep apnea symptoms, we have to do some scale and some assessment for this patient. We check this template, and you see this chief complaint has to follow up, because we use two templates. We can delete one of them. Okay, and this is the Epworth sleep scale. We need to ask this patient about these questionnaire questions. You check OSA, and you check these three dots, and you ask the patient this question, and you explain everything to him. I'm gonna ask you a couple of questions, and this is a scale. 0 means that, 1 means that, 2 means that, 3 means that, and you ask him if he has any of these problems, and you put numbers over here. I fall asleep while watching TV all the weekdays. 3, 2, 1, whatever, and then you calculate the number. 2, 4, 6, 8, 10, 12, 15, 17, and you put the total score over here, 17, and then you check OK, and then you close the screen. So now you have the scale, and you have the total score of the scale, and that means that this patient has obstructive sleep apnea. You will find it here in the assessment, and this patient, we will refer him to a sleeping study test. Then you go to the treatment section, and you go under the obstructive sleep apnea, and you add a note, refer to sleep study. Okay, so everything you do to the patient, you have to document it. We did the OSA sleeping scale. We did the also I wanna mention some important stuff about the patient documents. You can find all the patient's labs and MRI results and ultrasound and everything. You will find all documents of the patient in here, this section, patient docs. You click the patient docs, you will get this screen. You will find any MRI the patient has done, any PFT, any lab results over here. So all the information you will find over here. Also there are some preventive we need to do to all patients. All men more than 50 years old, we have to do colonoscopy. So you go to CDSS section, and you can change these or check for these screenings. A patient a female patient has to do a mammogram after age of 40. You ask, did you do mammogram or not? If she did it, okay, you can go to this circle and enter when did she do it. If she did it 6 months ago, you check 6 months and then okay. Let's say the colonoscopy. The patient did the colonoscopy. If the patient tells you that he did colonoscopy 1 year ago, you check here over. You see this patient already done. You check on this H, and you can change the date. So these screenings are very important. You can get it from CDSS. The breast mammogram for females, the colonoscopy for males, the hemoglobin A1C for diabetic patients. Let's say, for example, a patient refused to do colonoscopy. You have to document this as well, and we have some templates for refusal patient. If a patient refused colonoscopy, you check this template. You will get some information over here. Patient refused to have colonoscopy. If a female patient refused to do the mammogram, you have template. If you used to do pap smear, you have template. If you used to do eye and foot examination, annual visit for diabetic patient, you check this template. So we have templates for refusal patient. We have template for medications refill. Okay, you have some templates for initial patients. You have some templates for a medical clearance patient, for patient undergoing surgeries. Okay. Okay, quickly I want to show you how to file the labs and how to file the imagings from different sites, from different websites. We have different labs, as I told you: Quest, BioReference, and LabCorp. BioReference is the most we use it this is the most lab that we use is BioReference. So let's say this patient, we need to search for a patient June 10, 1990. You go to a patient, you go to the patient name, you copy the patient name, and then you check this print thing, and then you print, and then you click this one, not the print. You click save, and then paste. You paste the name and then save, and it has to go to doctor's labs. Okay, let's say we need to file an imaging from Bay Medical Imaging 1/1990. You check the patient date of birth, and then you go to the imagings that you want to save, and then you copy the patient name, and then you check show printer friendly version, and then Control B, and then Microsoft to print to PDF, and then to paste the name, and you have to type what is the name of the diagnosis: CT scan of the abdomen and pelvis. Okay, and you have to write it this way. The first letter of the diagnostic of the name, it has to be the first letter of the first word has to be capped like that, and of that has to be lowercase like that. Okay, and then save. Okay, from Dushi, same thing. You open the Dushi website. If you want to search for a patient, you can search from here. You put the patient date of birth. Let me go quickly to one of the patients on the home. This patient, Ramadan Ibrahim. You click on the patient name, and then you copy the patient name, and then you print, I agree, download report. Okay, and save as, and then paste the patient's name. And let's say this patient had DEXA scan, so with DEXA scan, you see the first letter of the first of any word has to be kept. Okay, and then save.
وبقى ايه الحلقة الجاية لو في عايز تكمل حاجات تانية ممكن نعملها حلقة تانية عشان.
Okay, so basically we went through most of the basic stuff for our system here in Sinai. we're gonna make another video for some more detailed stuff. Hopefully I give you some useful information for you, and very soon we'll make another video for more informations. Thank you. Okay, so finally we got done with this video. We basically went through most of the basics of our system here. We still need like more videos in order to give you all the informations. Soon we'll make another video to give you some more information and give you some more tips on how to use the eClinicalWorks system in order to get to perfection. See you soon, guys.